This is a speculum. This is an instrument that's often cold and uncomfortable. And for a pap smear to be done, a woman needs to be lying down on bed in quite a vulnerable position and have her hips abducted, that means open wide, so that the healthcare professional can then put this instrument in to visualize the cervix and then take some samples from the cervix, which is the neck of the womb where the baby comes out. So we're all made of different sizes, and some Asian women are slightly smaller, and this can be quite an uncomfortable, if not painful, procedure.
There's only one size?
No, there are many, but in real clinical settings, sometimes there's only one available.
And can only a healthcare professional carry this out?
So that depends where we are. So in other lower income settings, it may be a community health person, but in the setting of Malaysia, it's usually a doctor or a nurse. So that's that. And to do this to scale, you really need to have beds everywhere, a private setting, nurses or doctors available to screen every eligible woman at least once every 3 years. So in terms of infrastructure and human resource, it needs a lot of people. And then someone will have to look at the cells, which I'll leave it for Marion to describe later on. So with the advent of COVID, everyone understands what a swab is and what a PCR is. So essentially, the new method we're talking about, we've talked about self-collection, self-testing, self-swab. What it means is that a woman can essentially use a swab such as this, insert it into the birth canal or the vagina. So this doesn't need to reach the cervix. It just needs to reach the lower part of the vagina, where she then takes a sample and then put it back into this tube, and a PCR test will then identify whether there's a presence of an HPV that's associated with the risk of developing cervical cancer.
Okay.
So 2 of these tests a lifetime, as opposed to 15 of these tests in a woman's lifetime.
And if you're not comfortable doing it yourself, you can actually get a healthcare professional to do it for you as well.
Of course.
Okay. Marion?
We are seeing a great uptake of self-sampling, and I think it's partly because it's positioned as a choice and people are finding that very empowering. Our early data are suggesting that it's been taken up disproportionately in the very communities we want to reach. So that's in our Aboriginal and Torres Strait Islander communities, in our remote locations, and amongst people who are residing in areas that are associated with poorer access to resources, lower socioeconomic areas. So that's fantastic. We still have some barriers, which are a little bit ironic, that the least uptake of self-collection is in our most affluent areas, where some of our GPs still don't understand that this test is as good. And they are thinking that this is a test that's only for people that won't have a clinician-collected sample. So every country and setting has its own challenges. And for me, I'm not concerned too much about that, except to say that in those practices, there will be people who would have appreciated the choice, who perhaps aren't being given the choice at the moment. And that's the role of practitioner education that we have to do in Australia.
I think as a clinician, as a doctor, as a gynecologist, this tool is my most basic tool. I've been taught to use this for many, many different procedures. I understand it's difficult to say this may not be necessary. I mean, most of us in medical school are taught to insert a speculum, and as far as we know, as long as we've known, visualizing the cervix to see if there's any abnormality, then taking a sample is best practice. And to now say that you don't need to look at the cervix, to then take a swab, not from the cervix, from the lower vagina is a huge step of faith or even a huge paradigm shift, but the evidence is very strong. The evidence is there. Look at the evidence and it will tell you that an HPV test done correctly is actually superior to a pap smear in the best of settings.